Well, a highly contagious hepatitis A outbreak continues to impact our area.
And we're joined now by Dr. Chad Sanborn, pediatric infectious disease physician at Palm Beach Children's Hospital. We're really glad you're here.
Thank you.
I want to start with what we need to know about vaccines. A lot of questions about this. If someone has been infected, do they need to get the vaccine then after the fact?
No. If you have the bad luck of getting infection, you actually have a very good protection against the virus moving forward. So people who have already been infected with the virus do not need a dose of vaccine after that.
What about as preventative? Who should be getting the vaccine, before?
Right now, we're trying to recommend the vaccine to certain high-risk groups, which include men who have sex with men, people who are using illegal drugs, and people who are experiencing homelessness at the moment. That seems to be the highest risk category, and many of the cases in Florida seem to have one of those risk factors for disease. That being said, if you have existing liver disease, are immune suppressed, so your immune system is not working at full strength, it's not a bad idea to get vaccinated. And the open category, anyone who wants to get vaccinated certainly can go ahead, particularly adults, where it seems to affect adults worse than children.
Go into the age just a little bit. What about, young children and, older adults, our seniors?
So, young children, as of 2006, it's been kind of one of the recommended vaccines for all children at age 1 since 2006. So if you're born before then, there's a good chance you haven't gotten vaccine. So the highest group seems to be in the 30 and up range. So adults seem to be higher risk for it, and senior citizens potentially at higher risk for getting worse disease if they have other medical conditions. So a vaccine is a 2-dose series, and it's not harmful, so it's a killed vaccine, so it's actually pretty safe for all groups to get. That being said, we try to focus to older individuals and adults because children are already vaccinated.
I know there are lots of people up in Martin County worried about these deaths that are here, and now there's a report that possibly a brother of one of those who have died is also passed away after having contact with the surroundings. Do people in Martin County need to worry about where these people have been, if they've had any contact with these people in the past couple weeks?
Well, certainly it's of concern. The problem is that, one, we're not exactly sure what introduced this virus into the county. Now, it's been a nationwide thing since 2017, and even in Florida, it's been going up since around 2017, the number of cases. It seems to have made its way down to Martin County, and now it seems Palm Beach as well. But nothing necessarily in particular. However, one of the bad things is that the symptoms can be latent for a while, meaning it may take up to a month to show symptoms after having been exposed to it. So not to panic people, but no, if you're not well or experiencing a gastrointestinal illness, such vomiting, diarrhea, or jaundice, it's probably a good idea to see your physician.
Dr. Sanborn, thank you so much for your time. Appreciate the knowledge.